For weeks, you and I have talked about monkeypox cases spiking across the country and, of course, right here at home, which got us wondering, how are things looking right now? Evan Kosloff spoke with the experts and took a hard look at the numbers to verify.
In late August, CDC Director Dr. Rochelle Walensky said that she was cautiously optimistic that monkeypox might be slowing down. And on social media, we've seen people asking about whether this trend has continued. So let's verify with some help from our sources: the CDC, public health agencies from Maryland, Virginia, and DC, and emergency physician Dr. Adam Brown. First, take a look at the national numbers. This graph shows weekly case increases. And as you can see, the peak was in mid-August when there were 3,246 new cases in a week. In the latest week of data, between September 1st and September 7th, there were 1,699 new cases.
I believe that some of the reason for that is we're starting to see some of our mitigation strategies and tactics starting to improve outcomes here and reduce the number of cases.
Next, let's talk local numbers. In DC, the peak was back in July when there were 92 new cases in 1 week. Compare that to the latest week of data when there were 25 new cases. In Maryland, meanwhile, the peak was in late August with 112 new cases in a week. The latest week of data was just a third of that, with 37 new cases. And in Virginia, the peak was in mid-August with 59 new cases. The latest week showed 44 new cases. So we could verify that the latest data show that case numbers are down from the peak. But Dr. Brown tells us that we shouldn't jump to conclusions.
That does not mean that the virus is completely going to be eradicated tomorrow. That just means that the trend line is down. That trend line can turn and go the opposite direction.
With your Verify, I'm Evan Kosloff.